audience. Let me introduce myself. I am Benjámin Skribek, and my main PhD title is The Significance of Minimally Invasive Interventional Therapies, Effects in the Treatment of Various Diseases. My vision is that minimally invasive therapies will be readily available solutions in the treatment of multiple diseases, mainly cancers, tumors. Our mission that we would like to simplify the treatment of patients suffering from various diseases, especially tumors. Our aim is to launch novel, human, effective and safe therapies in Hungary. I have two ongoing projects. In this project, we would like to compare new interventional therapies with the gold standard therapies, mainly surgical therapies of diseases, mainly tumors. My first project is investigating the efficacy of minimally invasive interventions versus laparoscopy in the treatment of early-stage adrenal gland tumors. It is a meta-analysis and also a systematic review. Let me start with the prevalence of adrenal tumors. It is 532 per 100,000 person. Adrenal tumors has many serious clinical consequences. For example, high blood pressure, hypokalemia, constipation, diabetes, and other organ failures. Nowadays, the gold standard therapy is laparoscopic adrenalectomy. But laparoscopic adrenalectomy not always applicable because the therapy sometimes depends on the condition of the patient. For example, the patient has anemia, extreme obesity, which is exclusion of the surgery. And it depends on the tumor type also, the size of the tumor and the hormone-producing possibility of the tumor. LA has relatively prolonged postoperative hospitalization. It is usually 3 or 4 days. But nowadays we have many new interventional therapies, procedures, for example, embolization, mechanical and chemical and thermoablation therapies procedures which can replace the gold standard therapy, the laparoscopic adrenalectomy. This minimally invasive techniques has reduced interventional duration. They have decreased blood loss and less postoperative hospitalization. It's usually 1 or 2 days. And it has faster recovery. Our aim is to compare laparoscopic adrenalectomy and minimally invasive interventions in the treatment of early-stage adrenal gland tumors. Our clinical question is that our minimally invasive interventions are safer, more effective therapeutic options for patients with early-stage adrenal gland tumors than laparoscopic adrenalectomy. The population is the patients who has early-stage adrenal gland tumors. We would like to compare the minimally invasive interventions with laparoscopic adrenalectomy. We have primary and secondary outcomes also. Our primary outcomes, the complication rate and the success rate, which is the biochemical success rate. Our secondary outcomes are the operation time, the postoperative recovery, perioperative blood loss, analgesic requirement, and postoperative medication. So our hypothesis that minimally invasive procedures are safer and more effective therapeutic options than laparoscopic adrenalectomy. We have made the systematic search. We have used 5 databases: PubMed, InBase, Scopus, Web of Science, and Cochrane Library. After the selection procedure, I had 5 eligible articles. And I started the data extraction, and we would like to finish it on this month. My second topic is investigating the efficacy of minimally invasive interventions versus radical prostatectomy in the treatment of localized prostate cancer It is also a systematic review and meta-analysis. The prevalence of prostate cancer is really high after 70 years old patients. The localized prostate tumors are usually asymptomatic tumors. And the gold standard treatment is radical prostatectomy, which is included the pelvic lymph nodes, the prostate, and the seminal vesicles, and that's all. Radical prostatectomy has many complications. Erectile dysfunction, it has a really high percentage. Total and stress incontinence, rectal injury, wound infection, and anastomotic stenosis. But we have also new therapeutic procedures. For example, thermoablation, high-intensity focused ultrasound therapy, irreversible electroporation, laser, and re-irradiation or external beam radiotherapy. Our aim is to compare radical prostatectomy with these intervention therapies in the treatment of localized prostate tumors. Our clinical question that are minimally invasive interventions safer and similarly effective therapeutic options as radical prostatectomy for patients with localized prostate tumors. We would like to examine the patients with localized prostate tumors and to compare minimally invasive interventions with radical prostatectomy. We have primary and secondary outcomes. Primary outcomes are the next: complication rate, progression-free survival, which is biochemical and clinical evidence of localized disease. So our secondary outcomes are overall survival and bowel toxicity. Our hypothesis that minimally invasive interventions are safer but as effective as radical prostatectomy. Here you can see my preliminary search. Here are the 3 domains, and I used only 3 databases, PubMed, Embase, and Cochrane Library, and I have almost 34,000 articles. In summary, so I have 2 ongoing projects, and we would like to finish these projects next year on May. I would like to close my presentation with the words of Benjamin Franklin: "Tell me and I forget, teach me and I remember, involve me and I learn." Thank you for your attention.
Congratulations, Benny, for the nice project and the nice presentation. I have one question for the first project. How could you measure the perioperative blood loss?
Yes, we would like to measure the drop of hemoglobin level after the intervention or the surgery.
In your second project, actually, you have an extremely high number of articles. So can you actually focus more on, since you have a specific question, so maybe you can modify actually your questions so you get better on target. And maybe there are some other reasons, and there is such a huge number, but maybe some of the keywords actually widen that so much.
Okay. We can make a point, but there are many new techniques, many interventional techniques, which I suggested recently. And when I try to find key articles, I find many of them which is focus only electroporation technique, thermoablation technique, and I would like to extend all the interventional techniques to compare with radical prostatectomy. And if I would take out one of them, it will be not for that I want to reach.
This is actually not a criticism. I mean,
yeah.
Especially because with your second project, I mean, you are in a very early stage of that. But to formulate a good question, again, this is a good feedback then when you see that actually you are on target.
Okay, I see. Thank you very much.